People on Ozempic are reporting something unexpected. They have completely lost the urge to drink. Not reduced. Gone. Now the science is backing it up, and it could change how we treat addiction. The reports started as anecdotes. Patients on semaglutide or tirzepatide for diabetes or weight loss noticed they were drinking less. Some stopped entirely, not because they decided to, but because the desire disappeared. Social media filled with these stories. Then researchers started looking. A May 2026 publication in JAMA Psychiatry reported results from a controlled trial of semaglutide for alcohol use disorder. The trial randomized about 200 participants with moderate to severe alcohol use disorder to receive semaglutide or placebo for 16 weeks. The semaglutide group reduced heavy drinking days by over 40% compared to placebo. Total drinks per week dropped by about 35%. Craving scores, measured with a validated scale, decreased significantly. These are not subtle effects. How does a weight loss drug reduce alcohol consumption? The mechanism appears to involve the same brain pathways that regulate food reward. Alcohol activates the mesolimbic dopamine system. So does food. GLP-1 receptors are present in the ventral tegmental area and the nucleus accumbens, which are core components of that reward circuitry. When a GLP-1 agonist binds to those receptors, it attenuates dopamine signaling. The reward value of alcohol decreases. The craving signal weakens. This is the same mechanism that quiets food noise. It is not specific to food. It applies to any reward-driven behavior that runs through those circuits. Animal studies predicted this years ago. Rodent models consistently show that GLP-1 agonists reduce alcohol intake, cocaine-seeking, nicotine self-administration, and opioid-seeking behavior. The human data is now catching up. A separate 2025 pilot study at the University of North Carolina tested semaglutide in people with opioid use disorder and found reduced drug craving scores, though the sample was small. The implications are significant but complicated. Alcohol use disorder affects about 14 million adults in the United States. Current medications, naltrexone, acamprosate, and disulfiram, have modest efficacy. Relapse rates are high. If GLP-1 agonists prove effective in larger trials, they could become a new pharmacological option for addiction treatment. Several phase 3 trials are now recruiting or underway for alcohol use disorder, opioid use disorder, and smoking cessation. But there are real concerns. Off-label use of GLP-1s for addiction is already happening. Some patients are asking their doctors for Ozempic prescriptions specifically to reduce drinking. That is not what the drug is approved for, and we do not have long-term safety data for that use case. The dose, duration, and monitoring protocols for addiction treatment may differ from obesity or diabetes treatment. Prescribing GLP-1s off-label for addiction without formal guidance could create problems, including inappropriate dosing, lack of behavioral therapy integration, and missed contraindications. There is also a debate about whether the alcohol effect is separate from the weight loss effect or simply a consequence of reduced appetite generally. If GLP-1s reduce all consumptive behaviors by dampening reward sensitivity, that is a broader pharmacological profile than we currently describe these drugs as having. Some researchers think that broader profile is exactly right. Others think alcohol reduction is a distinct pathway that deserves independent study. For now, the evidence is promising but preliminary. One controlled trial is encouraging. It is not definitive. Larger trials will tell us more about efficacy, optimal dosing, and who is most likely to benefit. If you are on a GLP-1 and notice reduced alcohol consumption, that is a real effect. It is not in your head, but it is not a reason to start a GLP-1 for that purpose alone, not until we know more. Talk with your clinician before making any medication changes. For plain language GLP-1 updates, visit theglpspot.com.